Okay, let's move on. So, what is Bell's palsy? That's an interesting one. Bell's palsy is a neurological condition caused by idiopathic paralysis of the facial nerve, cranial nerve number 7, named after a Scottish surgeon that first is reported to describe this condition way back in the 19th century. So before we get on to Bell's palsy, let's talk a little bit about the facial nerve, which is known to be the nerve that's interrupted or the nerve affected in Bell's palsy. The facial nerve, just a small little summary, is a nerve that leaves the middle cranial fossa through the so-called facial canal, which opens up inside in the internal cruciate meatus. The facial canal, known because it carries the facial nerve through the temporal bone, making a Z-shaped, about 3 centimeters long, leaving through the stylomastoid foramen, which is probably best seen underneath the cranial base, right here between the styloid process and the mastoid process. And as it leaves the stylomastoid foramen, it moves laterally and goes into the parotid gland, giving off 5 branches of the facial nerve known as, let's get a table up, the temporal branch, the zygomatic branch, the buccal branch, mandibular or sort of marginal mandibular branch, and the cervical branch. And these branches then innervate the so-called muscles of facial expression, the muscles responsible for all the expressions a face can produce: happiness, sadness, and all the spectrum in between. This is best seen in a live diagram where every muscle is demonstrated on a live human. Let's get that picture up right here. So you got all of these possible facial expressions that can be formed in a normal human with a normal functioning cranial nerve number 7 facial nerve. So Bell's palsy, also known as idiopathic facial paralysis, unilateral facial paralysis, is an unexplained episode of facial weakness or paralysis unilaterally, just on one side. It's a condition that happens suddenly and worsens generally over 48 hours, and it results from some sort of damage to the facial nerve, and normally there's inflammation seen as it leaves the styloid, mastoid foramen. So if you look at the muscles of facial expression, all these are possible. So let's get a diagram up. So all this is possible. So if over here a normal human smiling here, or a diagram of this, you've got a nice tone as well. In Bell's palsy, shown on the right hand side here, the muscles are weakened or they're paralyzed unilaterally just on that side of the face. And normally the diagnosis of Bell's palsy is they're normally checking for 4 different things. The inability to wrinkle the eyebrow. Normally they're expecting to see a drooping eyelid or the inability to close the eye. Inability to puff the cheek or asking the patient to smile, and it'd be an asymmetrical smile. And normally the drooping of the corner of the mouth or patient reporting a dry mouth. They normally ask the patients in order to check all of these. Start from the top: inability to wrinkle the brow, drooping eyelid, inability to close the eye, inability to puff the cheek or asymmetrical smile, or drooping of the corner of the mouth, or a dry mouth. And what they're doing really here is they're checking all these muscle facial expressions, but they're going in order. If you pay attention to these 4 things, let's get a diagram up with this. The 4 things they're checking for. If you overlay terminal branches of the facial nerve, let's put this here, one by one, try and line these up. That's what they're checking for. So the overall checking for facial nerve weakness or paralysis. Normally in these diagrams you see a red eye as well. Because the inability to close the eye, it's very easy for this eye to get infected as well. So normally the treatment for Bell's palsy, generally speaking, is a 10-day course of steroids, eye drops, and/or eye ointment, and treatment normally starts as soon as possible. You can't really prevent Bell's palsy. It's thought to be known to be caused by a dormant viral infection, but nobody really knows the cause of this. You can sometimes get it more than once, and the good news is most people normally recover within 8 to 9 months. Some people never recover, and there's many known causes, all the way from a viral infection to possibly even stress, but nobody really knows the true cause. I'm hoping that helps. Is a atypical facial nerve paralysis affecting one side of the face, resulting from damage to cranial nerve number 7, the facial nerve. Hope that helps.